Doctors from the American Academy of Pediatrics are warning American parents, telling them this morning not to listen to any changes to childhood vaccine schedules coming from this CDC panel of advisors.
It's truly heartbreaking to see discussions framed under the guise of building trust, while in reality they were actively sowing fear and doubt. I really don't think you can trust anything that comes out of this committee.
Late Thursday, arguing that it will improve safety, the panel decided to separate the chickenpox vaccine from the widely used combination vaccine that fights the measles, mumps, and rubella, meaning that children will need another shot for their first dose, explaining that this slightly lowers the risk of possible seizures experienced by some children getting the vaccine. Today, the panel is expected to vote on the hepatitis vaccine given to newborns, a public health policy that's more than 30 years old and has greatly prevented transmission of the disease from family members to children. One of the considerations is to wait and give the vaccine to children later.
The one given at birth almost completely eliminates chronic hepatitis B and liver cancer in children. Let's just pause for a second. We have the ability to prevent children from getting cancer if we give every child a hepatitis B birth dose.
This mother of a 6-year-old and a 2-year-old from Miami tells us she's confused and frustrated by the changes, worried about wild stories that vaccines could hurt her child, but at the same time realizing that they stop dangerous diseases.
It's very difficult to make a decision because of all the information. Not just from the CDC, not just from our government, but from other voices online and all around us.
The changes are coming from the new advisors picked by Health Secretary Robert F. Kennedy, a longtime vaccine skeptic who filled the panel with several members who share his feelings. Everything that's decided here still has to be approved by the director of the CDC before it becomes official. But what they decide matters and affects what vaccines are made available to American children. Specifically, what vaccines the government provides children for free and which ones insurance companies will cover.
Yeah, it really could hurt the uninsured. No question about that. Steve Osunsami, thanks.